Okay, dah live ke? Dah live aja.
Dah live dah.
Okay. Tak nampak dekat dalam apa ni? Okay. Assalamualaikum warahmatullahi wabarakatuh, and we are live. Our Facebook, CCSC Facebook, Alhamdulillah. So I am Sister Khairiah, Abdul Razak, Senior Clinical Psychologist from CCSC. I'll be your moderator for today. So we're going to talk about adult ADHD, how they struggle, what is actually adult ADHD. It is actually organized in conjunction of ADHD Awareness Month and also Counseling Month 2024. Okay, so basically, we have a very incredible speaker panelist today. Okay, so before we introduce our panelists, so I would like to say thanks to all the audience who joined us through FB Live. Okay, who actually maybe all of you can share our live to your friends and ask them to join us so that we can get to know about ADHD, because I think the awareness is there, but it's not enough yet. Okay, so we want to spread the awareness so that people get to know about ADHD more. Okay, and also I would like to say thank you to our panelists, Dr. Rozanizam and Dr. Atiyah, for being here, accepting my invitation, and willing to share the knowledge and experience with us so that we can get very fruitful discussion today, inshallah. Okay, and also regarding the attendance, okay, so you have to be aware that be alert that we will actually post the link of attendance in the comment section of our FB so that you can put your, you can fill up the attendance link and you will get the CTD point and also star point for the student. Okay, yeah, so now, okay, let me introduce our incredible speaker, okay, the panelists, okay. The first one is Dr. Rozanizam. I think IIUM students are also all Malaysians know Dr. Rozanizam kan, famous. Uh, so we have, Alhamdulillah, I'm very grateful to have him to be with us. Okay, Dr. Rozanizam, he is the psychiatrist in SASMED, IIUM Kuantan, and he also the lecturer in UI Kuantan as well. Also book writer, okay, book writer. If you can, you know, he wrote number of books, and I think boom juga kan buku tu. And then he is also mental health advocates and graduate from University of Adelaide, Australia, in Bachelor of Medicine and Surgery, and also graduated from USM, Master of Medicine and Psychiatry. Okay, so that's about the background of Dr. Rozanizam. Okay, so now we go to the second panelist. She is my friend also, and also Dr. Atiyah. Okay, ni pun famous juga. Famous juga kan, kita tengok dia selalu dengan apa Lisa Surihani kan. Okay, so Dr. Atiyah, she is a parenting coach, and yang paling penting sekali dia adalah someone that has been diagnosed with ADHD kan.
Yes.
So we want to listen to her and also macam mana she cope with this, she struggle and cope with her everyday life. Okay, and also she also a book writer for Project Muhammad, and graduated from also our alumni, graduated from Kulliyyah of Medicine, IIUM as well. And most interesting, she possessed a diploma in Islamic psychology. Okay, so anything before we go further, Dr. Atiyah or Dr. Rozanizam want to say something? Or we can proceed je?
I'm excited as always.
Okay. Okay. So ADHD, I think me as a clinical psychologist, I have been receiving clients who came to me and say that, oh, I I rasa I ada symptoms or criteria of ADHD. So we have to go through the thorough assessment so that we can baru boleh identify apa dia punya criteria and so on. But I think many of us cuma dapat dia punya symptoms or criteria dekat social media, dekat TikTok, dekat YouTube. But do we really know what is ADHD itself? Okay, so ADHD is a mental health disorder. It could be. Okay, so kita nak dengar dulu Dr. Rozanizam punya pendapat macam mana. Tapi kalau kita dengar banyak-banyak ramai yang kata dia sebagai mental health disorder, which is the includes a combination of persistent problem in terms of attention, hyperactivities, and impulsive behavior. So biasanya for the students who have issues like procrastinate, overly excessively procrastinate or being disorganized, dia rasa macam itu adalah aku kan. So dia pun datang and rasa macam I mungkin despite of having mungkin bukan depression tapi mungkin ADHD kan. So we want to know more about the criteria, what is actually adult ADHD. So that's why for today, I believe that it is very important kita dengar not only from the expert but also the one yang experienced and being diagnosed with ADHD. Okay, so we move further. Okay, so the first question to Dr. Rozanizam. Okay, kita terus bagi satu soalan yang ada macam dua combined question. Okay, first, how do ADHD symptoms typically manifest in adult, especially in if they were diagnosed in childhood? And the second one, what are the key differences between adult ADHD and similar conditions like anxiety and depression?
Yeah. Right. Thank you, Sister Khairiah, for the kind introduction and the question given to me. And also thank you to Dr. Atiyah for joining us today. Saya sebut ni as a host as well lah, sebab part of IIUM juga kan. And so Dr. Atiyah je tetamu. Kita dua-dua ni daripada UIA. So thank you so much for the opportunity given for us this morning. Three of us this morning to be talking about a very important topic. I'm equally excited as Dr. Atiyah to be talking about this, perhaps from two angles. One as a mental health professional that deal directly with those affected with neurodevelopmental disorders, particularly children and adolescents. And secondly, to also look at this from an adult perspective, because I believe many of us who are joining today want to know from adult perspective, not just simply understanding what's going to happen to children with ADHD while they were still young. And this topic is also interesting from my personal perspective as a father of a child with ADHD. So I'm still learning as a parent of a child with ADHD, and knowing at some point my boy, now who's 12, will become an adult and who will also have this part of himself lah. And so kita semua sedang belajar, because to me adult ADHD is relatively new from knowledge perspective as well as from experience perspective. To be honest, even as somebody trained to be a psychiatrist, tak banyak yang kita pelajari secara formal tentang adult ADHD. Kita go through a little bit masa kita belajar tentang children and adolescent. So a lot of knowledge and experience about ADHD ini is something yang dynamics and growing. So we learn as we experience it. We learn as we appreciate and acknowledge the presence of adult ADHD around us from mental health professional perspective or people with living experience lah. Apa yang Sister Khairiah sebut tentang knowledge tentang ADHD dan macam mana awareness about ADHD itu very true. Tapi I just want everyone to be mindful. We do not just want to create awareness tentang ADHD. We want to create awareness about the truth of ADHD. And because many people talk about ADHD, in fact, saya pernah highlight before this, macam mana there's a flooded of information tentang adult ADHD or ADHD itself in social media, and some are not even true. And contoh ada satu video saya pernah share, ada orang ditunjuk satu video, orang tu dia gerak-gerakkan kaki dia tak boleh duduk diam. So dia tulis kat situ, you might have ADHD. And so there was 1.2 million views. Simply just reflecting on that and that one particular experience, and then terus label it ADHD. So this is also something yang dangerous and we don't want. So kita nak create awareness about the truth of ADHD. So just reflecting on ADHD as general from clinical perspective, we learn ADHD ni as a neurodevelopmental disorder. Bermaksud condition yang started off during development period. So development period ni, initially we thought berlaku in the first few years of life. But later we start to understand that growing ataupun the process of growth of person continue to happen until late adolescent and early adulthood. So bermaksud issues with development tu can occur at any point during this growing period. Dan bila orang ada developmental issues, so dia akan manifest in different ways. So that's why kita bercakap tentang autism, for example, speech delays. These are all neurodevelopmental issues. So one of the neurodevelopmental disorders or neurodevelopmental issues that may happen comes in the form of ADHD. So as we know, ADHD ni dia ada two main symptoms ataupun main cluster of symptoms. One is inattention or difficulty to sustain focus and attention. And number two, hyperactivity and impulsivity. So based on my clinical experience, patients present with ADHD symptoms ni throughout different stages of life. So kalau dia present predominantly with hyperactivity symptoms, normally kita akan pick up this presentation much earlier. And so this is where kita jumpa budak umur 5, 6, 7 akan start presented with problems. So dia tak presented dengan ADHD, dia presented with problems. So problem dekat rumah, problem dekat sekolah, parents tak boleh control, cikgu report, ada issues dekat classroom, ada issues with peers. So the hyperactivity tu manifest, not just manifest, tapi causing troubles dalam dia punya kehidupan. So that's one, dia become disorder. So kalau dia aktif, dia happy, dia melompat-lompat kat playground, we don't call it hyperactivity yang disordered. And so it's just part of dia punya characters, dia punya personality, dia punya traits, dia punya temperament as a child. Tapi bila dia start affect dia punya function, that's when dia akan come forward untuk seek assessment and seek help. So this is the first cluster of presentation yang biasa kita akan diagnose awal. And there's the second cluster of presentation yang akan datang around the age of 9, 10, 11 and 12. Ataupun fasa sekolah rendah. So this is children with ADHD yang present predominantly with inattention. And so bila dia tak boleh fokus, dia ada issues with memories, dia ada issues with organization, dia ada issues dengan maintaining focus, distractibility in the classroom, dia akan start affected through dia punya academic performance, and that's when cikgu akan alert, parents akan alert. And so this is second cluster of presentation in children. And then third presentation yang kita jumpa among adolescent yang masuk umur 13, 14, 15 yang present dengan behavioral issues, especially if they were not diagnosed earlier on. And so the inattention, the hyperactivity tak manifest clearly, tapi dia start presented dengan behavioral problem because of the impulsivity component of the ADHD. So one of the component of ADHD is impulsivity, ataupun dalam bahasa mudahnya dia tak ada break. So dia tak ada ability untuk control dia punya behavior. So they start manifest in behavioral issues. So impulsivity, emotional issues, discipline issues, dah start nak pergi sekolah, melawan. So dia akan present sama ada with positional defiant disorder, melawan, ataupun kalau yang a bit extreme, dia akan present with conduct behavior. So start buat offenses yang a bit serious lah. And then there's a fourth group yang akan present, which is a bit later. And this is where those with adult ADHD akan manifest. Dia akan present a bit later. So those yang present a bit later ni, kebiasaannya dia dah ada all these symptoms. The inattention, the hyperactivity, the impulsivity. But given that sama ada symptoms tu tak strong enough ataupun tak significant enough, ataupun dia ada environment yang capable untuk contain the symptoms, boleh cope, maksudnya boleh control dia, boleh manage dia, ataupun ada issues with ignorant, parents tak tahu pun sebenarnya dia ada issues, ataupun dia ada issues with, ataupun dia punya environment tu is supportive enough, dia boleh survive through the process. Sehinggalah as an adult, bila datang demand yang lebih daripada apa yang dia mampu untuk cope, ataupun the environment is no longer supportive for that, dia perlu survive on dia punya own. And so this is where contohnya bila dia start buat PhD sendiri, bila dia start jadi parents, bila dia start running business, bila dia start bekerja dan dia kena bekerja ikut sistem, dia tak boleh bekerja ikut kepala dia lagi. So dia start dia crack. And so this group biasanya dia tak present with ADHD, dia akan present with issues in life, relationship issues, work issues, issues dengan boss, issues dengan pasangan, issues dengan anak. Ataupun, interestingly, sometimes we do see presentation of adult yang datang bawa anak untuk ADHD assessment. Anak dia yang hyperactive lompat-lompat, and then bila kita go through ADHD symptoms itself, parents tak realise. Macam saya je ni doktor, saya gitu juga dulu masa kecil. Ataupun apa yang doktor cerita tu macam apa yang saya lalui sekarang. And then they start realise. Because 25% of parents yang ada anak with ADHD ni, dia juga ada ADHD. Statistically speaking, from epidemiological perspective lah. So that's how they present lah. So that's how kita nampak presentation of ADHD in adults, yang sometimes berlaku sama ada the continuation of ADHD symptoms during childhood, ataupun something yang mereka tidak kenal pasti dan tidak detect earlier on, tapi manifest as an adult. Now, because symptoms of ADHD tu is quite banyak, dia ada 18 symptoms. Walaupun dia ada 2 main cluster, dia ada 18 symptoms. So banyak symptoms ni dia overlap dengan other diagnosis. So contohnya depression, anxiety. So sebab tu one of the important things dalam process of diagnosis of ADHD is a thorough assessment dan exclusion of other diagnosis. So ini dua benda yang penting yang hanya boleh dibuat oleh mental health professional yang trained to do so. And sebab tu it's not just about checklist or ticking the boxes. So dua proses ni perlu dibuat secara detail by mental health professional yang ada expertise in this area, so that kita boleh diagnose betul. Some symptom overlap betul, contohnya tak boleh fokus, orang anxiety pun tak boleh fokus, orang ada depression pun tak boleh fokus, but the difference is anxiety and depression ni dia ada other symptoms. And so dia ada symptoms, kalau depression dia ada symptoms hopelessness, worthlessness, suicidal ideation, self-harming behavior yang tak ada dalam ADHD itself. Anxiety pun sama, so dia ada physiological symptoms yang tak ada dalam ADHD. But it can occur as a comorbid. Nanti kita cerita tentang co-occurrence of this disorder. Tapi itu dulu sebagai permulaan untuk kita faham the bigger picture of ADHD sebagai permulaan lah. InsyaAllah.
Okay, thank you, Dr. Rozanizam. Very interesting. First, very interesting to know that Dr. Rozanizam son also have the ADHD. And another one is what we understand it is about ADHD is about neurodevelopmental, in which the disorder developed during the growing period, okay, and ada 4 phase in which ada beberapa apa orang kata range umur ataupun age range, the symptoms can be occurred ataupun obviously we can see. Okay, we starting getting the question from the comment, and later the committee or secretary will actually post in the chat box. And to the audience, if you have any comment or any questions, you can always put in the comment section, and the secretary will actually pass to me. We will read later on. Okay, so we go to the next questions. Okay, to our second panelist, Dr. Atiyah. Okay. I think you just got diagnosed from the past few years, kan, Dr. Atiyah?
Yes, that's right.
Yeah. So we want to know what was your journey like in getting diagnosed with ADHD and what made you seek help.
Okay, Assalamualaikum everyone. Thank you so much, Madam Khairiah, for having me. Of course, it's an honor to be in the same forum with Dr. Nizam, mashallah. Yes, I got to know my diagnosis. I got diagnosed in February 2021 because a very close friend of mine, roommate dekat UIA dulu, who is a fellow doctor juga, she was diagnosed with ADHD earlier than me lah. So I was 2021, did 2020. So she actually was sharing with me her blog post, her diagnosis of ADHD, and I was like, oh, macam konon, it's okay, like supportive of her. Until I think dia pun macam, kenapalah kawan aku ni tak dapat hint. And then she said, yeah, do you want, and then macam mana tak, macam we got into conversation yang I cakap macam, maybe I will patut check. And then she said, yeah, I think I want to suggest that maybe you should check because I don't know anyone who's more ADHD than you. Because dia kawan rapat kan, so dia boleh lah nak cakap macam tu. And I was like, oh my God, really? Okay lah. So I nak jumpa the exact doctor yang you jumpa. So I pun pergi jumpa Dr. Hazli. And so the first thing I jumpa Dr. Azmi, I cakap, doctor, I'm here because of my friend. So you kenal dia, she's your patient. And she asked me to come here. Okay, so why did she ask you to come here? So I said, she thinks I have ADHD. So the rest is history lah. I shared my symptoms. I taklah share my symptoms. Basically, I cerita my life. And I think from a psychiatrist point of view, macam Dr. Nizam sebutkan, the thorough assessment, exclusion of other diagnoses too. And I think it was easy for him to diagnose me at that time because I had a lot of the symptoms. And for me, yang memang I rasa bila I dah start to understand about ADHD lah, yang maknanya prior to going to see the doctor tu pun, and bila lepas dah jumpa doctor diagnosis tu, I rasa macam, oh my goodness, my life suddenly had an answer. It made sense. But I must say that I went through a grieving period after the diagnosis. Memang it's not easy to accept kan bila you have a diagnosis. But at the same time, dia a mixture of emotion between lega, pada masa yang sama sedih. Sebab, ya Allah, my struggle all this while is because of ADHD. Like I have a diagnosis. And Alhamdulillah, I told my parents, of course my husband was very supportive. And the doctor pun panggil my husband lah masa dapat diagnosis tu. And he testified lah kalau apa yang simptom I tu memang betul. And I rasa memang it made sense lah. It made sense to I punya impulsiveness, forgetfulness. But I thought it's just something that runs in the family. You know, like everyone forgets their keys. Everyone just tertinggal wallet or something like that, you know. And then through medical school dulu pun, I remember just being commented on, oh you ni tak macam the typical medical student. Adalah one lecturer pun cakap, Atiyah, you are so different from the others. And I just ingatkan, oh maybe because, I don't know, I'm cheerful ke apa. Tapi bila I tengok balik geng-geng ADHD ni, I can see lah, we share the same thing. Common thing yang I selalu dengar adalah, we've always been told that we are a bit different. And we are told that you light up the room, kan, because usually dia ada macam there's some kind of energy ke apa, but at the same time people don't understand why we are lazy, kan, macam oh you ni macam malas. Ada kawan I seorang tu dia cakap, Atiyah ni kat medical school lah. I think at that time actually it was very painful for me to get this comment, but somebody asked me, Atiyah awak kat bilik study tak? And I was like, sometimes. So dia cakap, itulah nampak macam malas. Macam, what? How could someone say that to me? But then I guess she was giving her opinion or observation, which was not good lah kan. Tapi it was like a smack in my face. And I rasa yang sedih tu sebab macam betul je dia cakap, memang aku rasa macam aku malas. Tapi at the same time, bukan yang benda lain I rajin kan. Benda ada mungkin yang benda susah, I find it very hard to do. And then one more thing I remember, maybe nanti ada next question kot, tapi tak apalah, I just, you know, ADHD kan, so macam semua dia nak terkeluar. And one more thing I remember, masa I form 3, I was supposed to do an art homework, pendidikan seni, dah buat, tapi I cannot remember where I put it. I tak jumpa homework tu. So bila cikgu minta dekat sekolah, I memang cakap, tak jumpa cikgu saya punya homework. Lepas tu cikgu tu memang, saya dah buat tapi saya tak tahu kat mana. And then she said to me, Atiyah ni memang macam ni, nampak rancak tapi hasil tak ada. You know, so I rasa from a fellow ADHD, Kalau siapa yang mendengar ni and you've been struggling, like I really understand what we gone through lah. Terlebih cakap, sorry Khairiah. I rasa I terjawab soalan seterusnya, tapi tak apa, nanti I share benda lain pula.
Nanti kita kalau you dah jawab, ada audience yang tanya soalan lain, kita bagi soalan yang daripada audience.
Alright, okay.
One more thing I can verify lah, masa sekolah dulu you memang very energetic kan. Lepas tu rasa vibe you yang paling cheerful, and bila once you kata you ada diagnosis, you got diagnosed tu, I memang tak terkejut pun. boleh nampak lah daripada kecil kan. Okay. So kita ada question, kita terus jawab je lah yang daripada audience ni. Okay, kita bagi kat Dr. Tia, lepas tu nanti ada Dr. Izam sekali. Soalan dia macam relatable dengan soalan yang pertama tu. So yang kita tanya Dr. Tia dulu, which is ada yang tanya specifically apa simptom ataupun kriteria yang very ketara ataupun yang Tia nampak memang ada yang menyebabkan you got diagnosed with ADHD.
Okay, alright. Memang macam exactly macam Dr. Nizam sebut tu. Phase yang lambat ni, dia mungkin the environment was supportive kan. So macam I had the structure. Maknanya sebelum ni mungkin ada, okay, satu sebab I ada kakak I, Aniyah kan. So she was actually my structure lah throughout secondary school. Sebab dia yang memang buatkan I jadual, suruh I study. And sebab my mom kan turunkan dia 1 tahun sama dengan I, sebab kita orang baik dari UK kan masa tu, you ingat kan? So I dengan dia satu kelas. So it was easy sebab homework sama. So I akan buat je apa dia buat, I buat. Walaupun I ingat masa tu apa yang Aniyah bila dia buatkan jadual, I macam tak faham. Macam I tak boleh grasp apa benda tu. Kenapa I tengok jadual tu, it doesn't mean anything to me. About study ke apa, I tak faham. Tapi I just tahu I buat je. And then apa yang structure tu. So my sister was a structure, and then bila dah masuk medical school, I think because kita in a program kan, so ada kawan everything, so ada that pressure, deadline, you know, you can do it, you boleh lah siapkan tu, walaupun of course lah ada struggle masa belajar tu. Tapi after I dah nak start kerja, okay, so I buat housemanship. It was a very big struggle for me lah. Sebab I rasa macam I don't understand orang lain boleh satu sebab I was a mother. So bila I dah start dapat anak, I rasa I have problem with focusing on many things at that time. I have to juggle work, nak pump semua tu. At the same time, I kat rumah I macam attached sangat dengan my daughter. So I think I struggle more than others sebab nak remember patients, and also sometimes I ingat like kadang I tengok patient, I'm like I remember her face tapi I don't really remember what is the management plan. I always kena refer balik. So I remember thinking like kenapa kawan-kawan I ni macam ingat dia orang macam pak dia boleh organize, but it was very hard for me actually to organize the task. Sebab bila kita houseman kan, you are basically you kena start to organize your work kan, banyak pula nak buat semua tu. So at that moment I dah rasa macam it's my problem. I thought like I am like, you know, macam a bad loser ke whatever lah, memang itu pun kau tak boleh nak buat macam tu. And then I berhenti housemanship sebab I nak fokus. I rasa macam I want to focus my interest. So my interest was more on motherhood. Macam tak penting kot nak kerja doktor, I want to ni. And then I business family. So bila business family, I was mula active at very happily involved. Ideas come from me. And then bila dah boring, you know, bila tu I cepat give up. And then nasib baik ada orang yang menyambut sebab family kan, so kita bukan seorang. But I myself felt very bad, like kenapa? What is my problem? Like what is this problem of ada idea banyak tapi I tak boleh nak follow up. I don't complete things, and I have a lot of interest, but then at the same time the shame comes in kan, like you seem fine, you speak well, but you just can't do certain things. So I think my main symptom is that one lah. And then yang macam tadi lah, macam impulsiveness and all that thing tu memang throughout my life I thought it's just my character, but rupanya dia adalah one of the symptoms kan. Yeah, so that's my part lah.
Okay. Thank you, Tia, for sharing that. And I also know that ADHD ni dia selalu macam tak boleh fokus in term of dia punya career ke ataupun interest tu, biasanya dia akan jam-jam, kejap dia yang ni, kejap lagi dia tukar yang ni kan. So nanti kita akan tanya more kat Dr. Rozanizam. Okay, tapi kita ada lagi satu soalan yang tadi sangat related dengan soalan pertama tu. Dia tanya dekat Dr. Rozanizam, so 2 years below cannot judge ke as ADHD ataupun just anggap as character? Macam mana, doktor?
It's a good question. Sebab tu bila kita tengok symptoms, we should not just look at the symptoms tu as a symptom. Oh, ada benda ni. Tapi kita tengok dia based on context. So contoh, for example, if you look at symptoms of ADHD, you akan jumpa contohnya dia kata tak boleh nak sustain focus. So if you think about it, kita semua sekarang ni, especially dengan dunia yang sibuk ni, semua orang susah nak fokus. Kan, even tengok Netflix pun, baru tengok separuh jalan dah stop, buat benda lain. Tengok scroll TikTok pun, kalau video tu 3-4 minit dah tak boleh. Dulu kita tengok YouTube 2 jam pun boleh. Tapi sekarang ni 5 saat je kita tengok. But that does not necessarily means kita ada ADHD. Sebab symptoms tu mesti dilihat berdasarkan konteks. Apa maksud konteks? Pertama, kita kena lihat adakah it's developmentally appropriate for the age. So for example, and kalau one of the symptoms yang listed dalam ADHD adalah always on the go, jumping and running around. So if you think about it, 2-3 years old, they're fueled by this. Sebab memang mereka energetic, part of dia punya development adalah untuk explore the world, explore the senses. So for 2-3 years old, jumping around, running around, that does not make them ADHD. Kalau tak, 90% of 2-3 year old ni ADHD lah. Tapi kalau a 7-year-old and darjah 1, tapi tak boleh duduk dekat meja dia. Kejap nak pergi tandas, kejap nak pergi dekat cikgu, kejap pergi dekat kawan, kejap dia ambil gunting, dia gunting beg kawan. That's not developmentally appropriate anymore. And so sebab tu kita kena tengok context and whether it's developmentally appropriate or not. So sebab tu the best way untuk ataupun the best time frame untuk diagnose, to me as a child psychiatrist ni, saya rasa around age 5 and above tu baru kita rasa lebih sesuai. Anything below that, kita akan monitor lah. Kita tak dismiss. Kalau memang betul parents struggling, kita akan keep an eye, wait and watch. Tapi bila kita dah besar, bila dia dah besar sikit tu, baru kita boleh appropriately judge lah. Ada satu question tadi saya jawab pendek je sebab soalan tu very specific. Dia kata, macam mana pula ada orang ADHD tapi dia boleh hyper-focus? Now, having ADHD does not necessarily mean kita ni attention span kita 2 saat je macam ikan mas. Tak. Ada orang yang ADHD can still boleh fokus. Tapi dia punya fokus tu fueled by interest. Dopamine driven. So kalau benda tu dia minat, dia boleh. Tapi the problem with kita as an adult ni, kita tak boleh maintain fokus kita berdasarkan interest sahaja. And kita kena maintain kita punya fokus based on task, based on requirement. So that's where orang yang ada ADHD akan struggle. So contohnya kalau dia seorang doktor, dia tak boleh pilih, oh dia minat dia apa? Dia minat dia buat prosedur je. So dia nak buat prosedur je. So dia tak nak ambil history, dia tak nak club patient, dia tak nak tulis note, tak boleh. So dia akan struggle in that sense. So orang yang ada ADHD ni dia akan struggle dekat aspek yang lain. They can still boleh fokus, especially benda-benda yang dia minat. Contoh ada orang kata, anak saya ada ADHD, tapi boleh main game 2-3 jam, sebab game tu dia dopamine fueled. Dan sebab dia ada apa? Dia ada reward. Settle ni menang, naik grade, naik apa kita panggil naik level. So itu yang fuel dia. Kalau belajar, dia tak dapat, tiba-tiba dapat star, dapat likes, dapat gift. So benda tu tak berlaku waktu belajar. So dopamine wasn't there, interest wasn't there, so dia akan depleted dia punya attention dia. Boleh faham kan?
Okay, boleh faham. Alhamdulillah. Okay, so I believe Dr. Rozanizam and Dr. Atiyah already answered some questions from the audience. So now we move to the next questions. Okay. So maybe Dr. Rozanizam can explain more about how can ADHD impact our daily life. Okay, in terms of, some of the students itself, ataupun we as adults, at times we feel like we are procrastinate too much or we feel so lazy. Adakah itu tanda memang kita ada ADHD? Because some people will say that, oh, itu boleh jadi excuse, ataupun how far we want to know, macam itu excuse ke, kan? So how actually ADHD itself can impact our daily life?
Okay, alright. Saya sambil-sambil kita di Zoom ni, saya duduk yang hijau juga ruangan komen, kita ada 200 lebih dekat kita punya Facebook live kita ni, dan banyak soalan-soalan yang bertanya. Saya pun ada ni, saya ada ADHD ke? Saya pun ada ni. ADHD ke tu? Sabar, relax, tarik nafas dalam-dalam. We're not here to diagnose anybody. I'm here to give professional opinions about adult ADHD. Dr. Atiyah share a personal experience. This is a platform untuk kita just increase kita punya awareness, and this is not a platform untuk anybody diagnose. Jangan habis session kita ni semua orang dah diagnose diri sendiri. So take a moment untuk just reflect on the sharing, and then nanti kita cerita what do we do to go about kalau betul kita struggle dengan ADHD symptom. Always remember, saya selalu sebut banyak kali, number one, it's not just about symptoms. We'll be talking a lot about symptoms, but it's not just about symptoms. Simptom tu mesti difahami berdasarkan konteks. Nombor dua, simptom tu dia mesti pervasive. Macam contoh yang Dr. Atiyah bagi tadi, it's not just seminggu dua punya problem. Dr. Atiyah reflect daripada sekolah menengah, and then masuk ke waktu kerja, as a parents, itu maksud pervasiveness. Dia continuous, dia bukan sekali-sekala. So kalau sekabut waktu nak exam je, waktu cuti happy seronok, tak ada inattention, tak ada hyperactivity, that's not ADHD lah. And so it's situational related. So for those yang ada ADHD ni, dia boleh relate symptoms tu, the almost macam part of themselves. So dia memang, maksudnya dia bukan episodik, dia bukan berdasarkan situasi. Tu yang seterusnya. Yang ketiga adalah symptoms tu is significant enough sampai dia impact kita punya function. So contoh ada orang kata, saya pun selalu hilang kunci, saya ada ADHD ke? So kita tak diagnose somebody just berdasarkan berapa kali awak hilang kunci. So it's not just that. So kita diagnose berdasarkan overall impairment. So kalau kita mungkin susah nak fokus, sekali-sekala kita lupa, yet kita still boleh function, it may not be a disorder. So maybe kita ada ciri-ciri ataupun traits yang towards that, tapi maybe tak sampai kita kata sebagai a disorder. So disorder ni bila kita punya function tu impact. Apa maksud function kita impact? Kefungsian kita sebagai individu, our day-to-day life tu affected. Kefungsian kita dengan orang lain, our social life affected. Dan yang ketiga is our occupational or kita punya academic life affected. Dan affected tu objectively lah. Maksudnya memang ada evidence that benda tu terjejas, terganggu. So contohnya kalau di relationship, it's not just us. Memang pasangan kita pun bagi tahu, saya struggle dengan dia. So coming back to the question Sister Khairiah tadi tu, macam mana dia affect? So if you understand symptoms of ADHD tadi, inattention-nya, hyperactivity-nya, impulsiveness-nya, semua ni bila tidak diurus dengan baik, tidak di-manage, dia akan impact life. Sebab life kita ni is being managed by these issues. Kemampuan kita untuk fokus, kemampuan kita untuk control tingkah laku kita, dan kemampuan kita untuk organize kita punya kehidupan. And this is the issues of those yang ada ADHD. Kalau orang yang faham ADHD is a bit deeper level, dia faham it's not just hyperactive, inattention, impulsivity saja. Ada another area yang akan affected by ADHD. Number one is kita punya executive function. So executive function ni termasuklah sebahagian tadi Dr. Atiyah highlighted beautifully tentang organization, memory, initiation staff, follow through task, following deadline. So semua ni prioritizing. So ini semua executive function. So those yang ada ADHD, executive function dia affected. Bukan sebab dia IQ dia rendah. Bukan, IQ dia tinggi. Tapi dia tak boleh nak execute how. So it's not the problem of what to do, but how to do it. How to go about doing what I know. Itu the struggles of people yang ada ADHD. So one is executive function. Number two is dia punya emotional regulation. And which is also another area yang tak listed dalam symptoms of ADHD, tapi those yang ADHD akan recognize. Dia struggle dengan anger, dia struggle dengan emotional control. Sometimes orang nampak dia happy, tapi deep down ada issues with self-esteem, ada issue with keyakinan diri yang akan affect dia punya overall functioning. Dan bila benda ni berlaku in the context of relationship, so dia akan struggle. Contohnya, bila ada pasangan yang tak faham, so pasangan akan struggle. Benda ni rumah aku ni tak reti nak masak, tak reti nak organize anak, lepas tu tak faham, kita dah plan, dah ingat banyak kali. So all these small things yang they're struggling with, akan create frictions dalam relationship, and that explain why a lot of people with ADHD involved dengan divorce, marital conflicts, relational issues, even issues dengan bos kat tempat kerja. Bila dia tak puas hati tu, orang lain boleh control. Dia, okay lah bos, saya resign lah. Kalau bos nak sangat, bos jadilah, bos buat lah. And saya fire boss as my boss. So dia lepas dia pun dia dah lepas. Sebab that behavioral control tu tak ada. So that's some of the struggles that we know occur dalam konteks those yang ada ADHD as a result of the symptoms yang tidak diurus dan tidak di-manage baik. And I guess Dr. Atiyah would have more personal reflection on those. Kalau betul apa yang saya cakap, she can second that. And kalau tak, maybe she can add what else yang we need to know about how ADHD symptoms affect life of those with ADHD. Wallahualam.
Okay, thank you, Dr. Rozanizam. Okay, so I believe that Dr. Rozanizam already mentioned and explained in detail about how ADHD can impact our life. Okay, especially for the adult. Okay, so next we go to the questions to Dr. Atiyah. Something that is maybe that kita tak jangka, tapi itu ada pada kita. Macam, are there any lesser known symptoms of ADHD that surprise you? Yang macam, oh, okay ni, macam tu. So, okay, Dr. Tia boleh share?
Okay, sure. The main thing lah yang I realise, it is related to ADHD juga. Walaupun I think yang macam Dr. Nizam kata, it's not listed in the symptoms, yang emotion tu. Yang emotional dysregulation, and also yang I'm not sure whether this is like really like ADHD, but apa yang RSD kan, rejection sensitivity, dysphoria, right? So basically yang kita ni susah nak terima rejection. So growing up, I always thought I ni jenis cepat terasa. Memang pun sampai sekarang. Cepat terasa, and also merajuk. So ni masa kecil lah especially, tapi bila dah semakin besar ni, merajuk dengan certain people je lah, taklah semua orang. Tapi kiranya I rasa kenapa, I ingat my friend, this one ingat, masa kita orang jumpa balik dah besar lah. I ingat tak dulu, Tia ni yang paling kuat merajuk. Lepas tu bila I fikir balik, it makes sense, you know, because dia macam ada satu, kalau kita terasa something tu, dia punya sensitivity tu higher. Yang contohnya satu lagi adalah emotion tadi, nak regulate tu it's challenging. So I ingat satu lagi benda, bila kita bekerja lah, yang kita senang benda ni I boleh observe. I remember like thinking, actually my problem with working is that I don't know how to regulate my emotion. I thought it's that. I thought bukannya memang simptom-simptom yang managing tu and everything tu dah susah. Tapi I rasa yang lebih mencabar adalah part emotion tu. Sebab dia adalah benda yang kita rasa kan. And kita memang rasa you don't want to be orang yang rasa kecil hati. Kita nak jadi orang yang matang kan. Macam orang yang dia letak dia punya emosi tu, dia rasa dia boleh letak ke tepi dan dia boleh operate dengan dia punya mind je kan. Dia buat decision semua. But for me, that was a struggle. So dia akan lead to behavioral impulsiveness tu lah. Kita punya benda yang okay tak nak lah. Macam okay lah, aku tak payahlah buat benda ni. Tak apalah, kau nak buat lah. You know, so ada benda-benda yang I rasa bila kita faham balik macam it makes sense, you know. So macam for now, bila I dah lepas diagnosis, on my so-called healing journey kan, maknanya trying to accept and be compassionate with your own self tu kan, maknanya I allow myself to feel the emotions kan. Macam okay, memang aku terasa gila sekarang ni. Sorry lah kalau saya suka perkataan gila, tapi saya tak tahu macam nak exaggerate perasaan tu, tapi memang terasa sangat, sedih sangat, marah sangat. Tapi now bila kita faham, kita dah tahu yang lebih, okay, it's okay kau rasa macam ni, kau bukannya masalah sebab kau ada terfikir macam ni, or kau punya perasaan tu excessive. Tapi now I feel better in managing that lah. I have my own tools for myself. Tapi sebelum ni benda tu susah untuk saya, dan bila kerja pun kita kan deal dengan banyak orang, especially I think in the medical world, people can be quite rough kan. Benda tu saya have a problem with that. Macam supervisor yang agak tegas, orang lain mungkin boleh terima itu sebagai instruction. Yes, dia orang akan terasa, kasarnya bos aku ni, ataupun terasa, but for me, dia macam extra. Dia punya, I ingat lagi, I describe kat my husband, abang tadi bos marah, kan? I tak tahu kenapa, tapi I nangis ni. I rasa macam kat dalam dia punya cucuk tu. It seems dramatic, but it's really how I felt, you know. And then sebenarnya ada satu lagi simptom I nak sebut, tapi I tak ingat. Oh, okay. I think yang messiness tu kot, yang bersepah tu, yang actually bukan ini I nak cakap, tapi tak apalah dah tersebut benda ni kan. I perasan satu benda lagi yang macam, kenapa I ni kadang-kadang bila kemas tu kemas sangat. I boleh buat sistem, organisation semua, tapi benda tu tak bertahan. Tiba-tiba I tengok balik, dah bersepah balik dah my room, dah bersepah balik dah my kids punya toys, dah bersepah balik ni. Tapi bila I organize tu, ada one time tu, I tengah hyper focus on decluttering sebab Marie Kondo tu, habis satu rumah. My mom ni ada duduk sekali, I declutter everything, including my parents punya wardrobe, my kitchen, my maid, sampai my maids. My mom punya maid semua kata, terima kasih Atiyah pula yang tolong kemas bilik kita, sebab I tengah macam hyper focus betul kat declutter. Lepas tu bagi tahu semua orang, kita kena declutter, kita kena ini, because masa tu I rasa macam that is like my focus and I could do it. I could accomplish that. I memang, everyone was so happy semua tu kan. Tapi then build up balik the clutter, you know, declutter and clutter. So benda tu lah antara benda juga yang I realise that, okay, it's not that I ni ada problem like I'm messy ke apa benda. It's just that there's something with my organisation tu. So that's why maybe kalau orang yang mampu ada maid, alhamdulillah lah dia boleh bantu kemas. Tapi mungkin orang yang tak boleh ada maid, maybe you need some kind of help untuk orang tolong kemas, ataupun macam dia panggil apa, kita suruh kawan kita cakap kau nak datang rumah nanti aku kemas, tapi sebenarnya orang tu tak datang pun. Sebab bila orang nak datang tu je kita akan rumah kita cantik sangat boleh kemas. So apa tadi I cakap tadi, yes. So simptom yang I rasa macam the things yang I tak sangka, actually it's attributed to my struggle with ADHD is that lah, emotion, and also yang tadi tu yang cepat merajuk and stuff. Maybe it's not directly related, I don't know, but itu my personal experience. And sebenarnya ada satu benda lagi I nak cakap, tapi I really can't remember now. Mungkin kalau I ingat nanti the next one lah I cakap, ya.
Kena tulis lah, tak dia.
Dah tu. Oh ya, okay, I kena tulis. Yang mana I tulis point lain yang I ingat I tulis nanti. InsyaAllah.
Yeah, I still remember tau, you pernah cerita kat I something masa kecil-kecil dulu. Masa kecil lah, kita tingkatan 2. And I cakap kat dalam diri I, wow, benda tu yang membuatkan you sedih sangat. Sedih. You cakap something to your mum. Pasal I terus cari I cakap, bagusnya dia cakap dekat mak dia macam tu pun dia sedih. Kalau I cakap macam tu kat mak I tak sedih pun. Macam benda yang tak patut sedih tau. Tapi I kata macam bagusnya ni memang anak yang baik lah. So I macam kagum dengan you masa tu tau. So sekali I boleh relate balik lah, why you have that kind of macam that situation kan.
Yeah, sensitivity dia tu.
Okay. So we go to the next question. Sebenarnya kita ada banyak juga soalan daripada kita punya audience, tapi saya sebenarnya ada satu, because I have benda ni berlaku for myself lah kan, saya ada klien yang ADHD. Lepas tu and it happened like dia ni bukanlah specifically orang yang ada ADHD, nak tanya doktor, so mungkin doktor boleh educate, adakah orang yang ada ADHD ni they are prone to actually involve in salah laku undang-undang, crime ke, macam contohnya, ataupun immorality ke, for adult. So maybe doktor boleh, sebab I believe that tak ramai orang tahu benda ni. So mungkin doktor boleh explain on this.
There's one interesting paper that I always quote, especially bila saya bagi talk to parents. There's a study looking into 147 of sexual offenders who are in prison in Malaysia. And the researcher did a retrospect study, melihat kembali apa yang berlaku dalam kehidupan mereka ini. And interestingly, 50% of these sexual offenders reported symptoms of ADHD growing up. And almost 2/3 of them quit school before age of 16 and left home before around the same age as well. I remember a very personal experience of meeting up a prisoner age 18 years old yang baru sahaja masuk penjara waktu saya buat forensic psychiatry posting waktu tu. Baru sahaja masuk penjara and he has another 20 years ahead of him to be in prison sebab dia dapat charge of 20 years of armed robbery. And bila kita go through dia punya history, memang very classical presentation of ADHD. So what happened was, memang waktu sekolah ada ADHD, tak boleh sustain behavioral issues, orang chop as nakal, tak rasa belong to school, drop out school, mix with different crowds who also have similar characters, similar interests, and then end up in substance and whatnot. And this is one of the trajectories. There are many trajectories of those with ADHD. Not everyone can follow the same trajectory, but one of the common trajectories adalah behavioral problem. Because one of the symptoms dalam ADHD ni adalah behavioral control. So for those yang ada good support, macam Dr. Atiyah highlighted earlier on, so most of them akan contain dalam good and supportive environment lah. Tapi those yang tak ada ni yang akan selalunya ada tendency untuk ada poorer outcome. And so menyebabkan mereka end up into this trajectory lah. Sebab tu kalau kita tengok those yang ada ADHD for example are 2 times more likely untuk involved with substance. And so ambil substance. And sometimes they take substance ni sebab mereka tak boleh function. Contohnya orang ambil stimulant, ambil ais, syabu, pil kuda and whatnot sebab dia tak boleh sustain. And the only way for them to sustain is bila mereka ambil this kind of substance. Without them realizing that their inability to sustain work tu is because of symptoms yang unrecognized and undiagnosed tadi itulah. And so sebab tu parents, it's important to recognize symptoms yang anak-anak ada from early on and seek proper assessment. Saya selalu sebut kalau budak buat hal, contohnya you heard 14 years old, tak ada masalah keluarga, tak ada masalah keuangan, tiba-tiba mencuri ataupun tiba-tiba pukul kawan, tiba-tiba lari pada sekolah pergi buat benda-benda yang out of characters ataupun something yang kita susah nak comprehend. The pathway is not keluarkan dia, masukkan dalam madrasah, bagi dia pendidikan akhlak ataupun hantar dekat rumah tok nenek kat kampung sebab duduk kat bandar teruk sangat, ataupun hantar dekat cikgu disiplin ataupun hantar dekat camp solat. That will not solve the problem. So what you need to do adalah sit down as a parents, think about apa sebenarnya isu dia. And then kalau you rasa isu dia relate dengan apa yang saya sebut tadi itu, seek proper assessment and then we look. And banyak adolescent yang presented to me with behavior problems, then only kita tahu yang sebenarnya dia ada undiagnosed issues with this. Saya nak just sentuh satu sikit je sebab I'm very interested with examples yang Dr. Atiyah bagi tadi tu. Sebab our understanding of ADHD in children and adolescent ni sebenarnya biased towards how it present in boys. And because the ratio of boy to girl with ADHD is 1:3, 1:4, depending on the study lah. So maksudnya in clinics, we see more boys with ADHD. So tak ramai girls with ADHD yang kita detect. Tapi interestingly, statistically speaking, as an adult, the prevalence of adult ADHD between female and male tu is pretty much the same. They're not that different. And so apa maksudnya? Maksudnya there are a lot of girls with ADHD growing up not being recognized that they have ADHD because dia punya presentation is slightly different. Many reasons. One is because intellectually they are a bit superior. So sometimes they know how to mask their symptoms, how to compensate for their symptoms. And number 2, dia ada social, macam kalau budak perempuan ni dia nak melompat-lompat, dia tahu nanti apa orang cakap. So dia control that. Tapi sebenarnya dia nak melompat. So dia tahu macam mana nak contain the symptoms. So sometimes benda tu tak nampak. So dia manifest differently lah. Dia join club tu, dia join club ni. Tapi sebenarnya those are dia punya hyperactivity being released into positive things. Dia subliminate into positive behavior. And so sebab tu penting. So selalunya kalau girls with ADHD ni kita akan detect through emotional problem. Kena bully, jealous dengan kawan ataupun kawan tak nak kawan dengan dia sebab kata dia ni pelik lah you ni. Sebab apa? Sebab tu yang ada ADHD ni biasanya dia punya emotional maturity dia is 20% less than peers of the same age. So dia akan struggle masa bila? Dia akan struggle masa tingkatan 1, tingkatan 2. Sebab waktu tu kawan-kawan dah period, kawan-kawan dah mature. Kan kalau budak-budak form 1, form 2 ni dia dah pandai melawar, dah pandai flip shawl kan, dia dah pandai malu-malu dengan ni. Tapi yang ada ADHD ni dia akan gangster sikit. Dia tak kisah tudung sengit-sengit pun dia tak kisah. So dia start akan rasa macam lain aku ni. Kawan-kawan yang cantik-cantik ni pun tak nak kawan lah dengan you. You ni macam selepek lah, you ni macam selekeh lah. So dia akan start struggle lah. So sometimes dia dapat depression. So datang kat kita. Sebenarnya underneath that ada benda-benda tu lah. So it really takes a good eyes untuk really detect this presentation, if you can appreciate apa yang saya nak sebut lah. Sebenarnya soalan dia apa tadi? Saya menjawab soalan tak?
Menjawab. Okay.
Okay. Saya lupa tadi soalan dia apa. Sebab saya menyentuh, saya rasa nak sentuh apa yang Dr. Atiyah highlighted tadi tu. Okay, kalau menjawab soalan tak apa, tak ada masalah. Sebab tadi saya nampak komen, one of the comments tadi tu datang daripada Arif. Arif kata Dr. Nizam ada ADHD. So, saya kata jangan diagnose diri sendiri. Arif dia pergi diagnose saya pula. Jangan diagnose saya. Okay, thank you. Thank you Arif for joining.
Sebenarnya dia nak bagi pick up line tu, doktor.
ADHD. Saya tahu dah Arif, sebab saya selalu berlari-lari dalam fikiran awak. Tak apa dah, tak boleh guna dah yang tu. Guna yang lain.
Okay.
Thank you.
Okay, so okay, tadi doktor dah jawab in term of prone to the any immoral or conduct issue, behavioral issues, or even ada more likely to get involved in substance punya issue. Okay, I think we go to next questions is about how to manage and how to handle and how to actually treatment itself, because I think we got also questions macam ada kat sini ada soalan dia, ubat Ritalin boleh diambil untuk long term ke, ada berapa soalan yang berkaitan dengan treatment. Okay, so maybe Dr. Rozanizam boleh you can explain what are the most effective treatment option for managing adult ADHD, both medications and non-medication approach.
Okay, alright. So with regard to treatments, again, another thing yang kita juga perlu faham adalah everyone is different. So even those yang ada ADHD pun, they might not be similar in terms of presentation, severity, and how much of their function affected. So we cannot generalize treatment to all ADHD patient. Because benda ni kita kena take with cautious, sebab I've seen many sharings, many videos yang sebut, bila saya ambil ubat, terus fikiran saya clear, saya rasa macam hidup ni berubah. So even though it might be true for you, it might not be to others. Nanti ada orang duk ingat macam kita ni ada magic pills yang akan solve all your life problem. Kalau ada, saya ambil dulu. Sebelum saya bagi kat orang, saya simpan lah, apa nak bagi kat orang kan. Ataupun saya jual harga mahal sikit. Tapi dia punya journey, tadi Dr. Atiyah guna perkataan journey untuk manage the ADHD itu is not as simple as going to see a doctor, being told you ADHD, given a pill, and then that solve your problem. So management here involve number one is educating yourself and people around you about what ADHD, how does this relate to me, what do I need to do in order for me to contain these symptoms. So education tu penting. Baca, belajar ni benda yang penting daripada sources yang betul. Nombor dua is treatment. So treatment ni comes in two forms. One is pharmacological, which is medication. Number two is non-pharmacological. Really depends on severity, and most of the time kalau dia severe enough, kita akan start discussing about treatment in terms of medication, sebab around 2/3 of those yang ada ADHD will require medication in order for the symptoms to improve. So not everyone, around 2/3, 70%. And around 2/3 of those yang ambil medication akan improve with medication. So if you think about it, roughly around 50% saja yang akan require medication dan improve with medication. So medication ni, saya tak cerita detail lah, kena jumpa doktor untuk faham. Tapi basically medication ni digunakan untuk treat chemical imbalance yang ada dalam brain kita. So ada stimulant, non-stimulant, so ada different types of medication. Dan medication ni tak boleh cari kat pharmacy, tak boleh beli kat Shopee, tak boleh beli kat TikTok. Dia hanya boleh di-prescribe oleh those yang ada authority to prescribe. And they're not cheap medication. Itu satu. Nombor dua, cerita nombor dua ni yang lebih penting. Sebab nombor dua ni semua orang boleh buat. Dan semua orang boleh dapat. Which is non-pharmacological. So non-pharmacological ni ada dua jenis. Satu is formal ni maksudnya kita dapat terapi yang spesifik ataupun coaching yang spesifik, daripada a trained therapist, sama ada clinical psychologist ke, developmental psychologist ke, ataupun counselor with additional training in coaching ADHD ke, ada certain module ataupun certain techniques yang boleh diajar through terapi. Basically mengajar untuk improve kita punya executive function kita tadi tu, emotional regulation kita tadi tu, yang boleh dibuat. Tapi yang informal adalah benda yang kita boleh belajar sendiri. Nanti saya cerita tentang macam mana kita nak apply those dalam kita punya kehidupan, basic things, ataupun maybe Dr. Atiyah boleh share her own experience macam mana manage those. Dan saya personally belajar a lot of this through satu life experience lah. Yang kedua is through apa yang saya buat pada ataupun apa yang saya ajar kepada patients dan kepada anak saya sendiri. Interesting fact, walaupun saya ni child psychiatrist, hari-hari diagnose anak orang dengan ADHD, autism, tapi my son only got diagnosed when he's 10. So that's how difficult it is to diagnose and how challenging can be untuk kita betul-betul appreciate the symptoms. Tapi the process tu, it takes a process untuk kita memahami. Without realizing, for example, daripada dia kecil sampai dia besar, tips yang saya ajar kepada parents untuk manage anak ADHD tu saya dah buat dekat anak saya sendiri. So, sebab tu anak saya dia boleh contain semua tu. And then bila saya reflect back, oh patutlah. So rupanya the way we manage him is basically the way we manage an ADHD child. And that's why dia boleh survive through. And sehinggalah PKP. Bila masuk PKP, saya kena jadi cikgu, mak dia kena jadi cikgu. So psychiatrist and radiologist kena ajar a 9-year-old, 8-year-old di sekolah. That's when we know. Before that tanya cikgu, okay. Tapi bila kita tengok dia sendiri belajar, baru kita tahu. So that's the I guess the beauty of the whole journey lah. It's challenging, tapi it's a journey worth exploring, especially those yang betul-betul nak membantu individu yang ada ADHD. Again, I don't know if I answered the question or not. Hopefully I answered the question. Saya ni kalau cerita pasal ADHD, autism ni, I can talk about it for 3 days, days and nights. So sikit-sikit lah kita bagi sikit-sikit.
Okay, tak apa. Nanti kita boleh ada sambungan lagi nanti, insyaAllah. Okay, untuk Dr. Atiyah kan, when you got diagnosed, and adakah you have been prescribed with medication ataupun how do you decide? You macam contohnya, what are the treatment options that the doctor give to you, and how do you decide to actually taking the treatment itself?
Okay, so first bila diagnosis tu memang doktor terus prescribekan ubat. Masa tu Ritalin untuk try dulu kan. Biasanya untuk try dulu, adjust to see how we adapt to it. So I ingat doktor suruh I try dulu dose ni, nanti after 2 weeks increase ke sini, and then you're gonna I have to tell him lah macam how is the experience and all. So I pun bila makan ubat tu, I rasa macam Dr. Nizam cakap lah, terketinggalkan magic pill. Tapi bila I rasa macam apa yang beza dia? Tak adalah I rasa macam woo, suddenly like I can do stuff differently. Tapi what I noticed was that I cakap kat doktor, I nak kata yang exactly I rasa ada big change tu, I tak rasa. Macam adalah macam significant change. Maybe dose masa tu pun tak sesuai dengan I ke apa. Tapi I noticed that I tak ngantuk. I do not need to sleep sangat in the afternoon. So biasanya I mesti nak kena nap. Or just gather myself macam tu. Sebab kalau tak, I macam overwhelmed. So doktor cakap, okay, that also shows for you that bila you tak makan ubat, all this while living with ADHD, you use a lot of your mental energy. Your mind is busy kan, hyperactive, your brain is working hard or overdrive, tak ada break. Tapi walaupun kita taklah nampak macam orang yang tak ada break, I lah rasa kalau orang tengok macam tak ada break je ni, mungkinlah juga I manifest in different ways kan. Tapi memang bila makan ubat tu, it helps me to calm, mungkin maknanya my brain tu dia calmer. So I do not need to struggle to use a lot of energy to complete tasks. Walaupun dia nampak very subtle, but for a person like me, I rasa macam, I can go on lagi. And also I notice is And then from there, like adjust. So doktor pun bagi I try yang long Concerta. So Concerta mula I minta yang higher dose. Then I pun, doktor I need more higher dose. And then I turunkan balik. Itulah itu kita macam sendiri as a patient, you know lah how to adjust kan. So the big changes yang I notice memang bila kita makan ubat, you need to know yourself. What are your challenges before, so that you pun sendiri boleh nampak tau apa sebenarnya yang how does it impact? Does it solve that problem yang you rasa sebenarnya problem sebelum ni? So for me, it's like energy level. And yang macam I kata tu, tak payah banyak fikir, sebab dia macam you bangun pagi kan, dia ada 1,000, orang ADHD kan dia ada 1,000 benda atas list dia. So benda dia nak buat. Tapi because dia selalu banyak sangat benda nak buat, dia tak tahu yang mana satu nak buat. So at least with me, bila ubat tu I makan, I kurang energy untuk kena fikir which one do I do first. Kalau tak kan dia kan tunggu benda yang 5 things tu kan. Benda yang akan instant dopamine tu kita macam novelty, benda yang urgent, benda yang challenging kan. Ada 5 things yang biasanya factors yang menyebabkan orang ADHD ni dia akan buat benda tu sebab all these things kan. So with ubat, for me it helped me to kind of like tak payah fikir banyak, kadang boleh buat. Dia kurang effort nak struggle, nak berlawan dengan diri sendiri tu. Tapi for me dalam this past almost 2 years, actually I dah tak makan ubat because hari tu kan ada global shortage on the stock of ADHD punya ubat. So masa tu I dah tukar ke Ritalin LA, which for me it work better for me than Concerta. Tapi I duk tunggu-tunggu stock. Memang struggle jugalah I rasa nak organize and stuff. Tapi pasal I pregnant and then now I'm breastfeeding. So for me personally, I decide to tak apalah, I bersabar je lah dengan simptom I ni, and I learn other things. I did try to go to therapy juga, and belum habis lah, so was it complete. Even for orang ADHD, I rasa personally lah Dr. Nizam, bila kita ni nak seek therapy pun, dia ada banyak benda dia fikir, overthink before going. Sebab I rasa for me it's like, I nak cakap apa? I don't know how, dia start to think of so many things. Tapi until my friend cakap, you know what, just go as you are. That is the role of the therapist to help you. Dia yang figure out macam nak tolong you. Tapi that help to kind of like, you talk and you have things that you discover about yourself. And then bila I broaden my knowledge on Islamic psychology juga, on the ilmu nafs, that also kind of like help me to understand myself better. And so basically for me betul, untuk ADHD treatment ni, dia banyak kan benda yang kita boleh bagi, bukan ubat sahaja, banyak-banyak lagi modalities yang we as a patient should seek, consult your professional, your psychiatrist ke, your psychologist ke, untuk tanya apa lagi yang saya perlu kalau saya ada masalah ni, what can help me. Then it's a customized program for each patient.
Okay, thank you, Atiyah. Okay, betul. You have to. I agree with Atiyah. You have to like always consult your therapist to get to know what to do. At times you have to do that. Macam I punya klien pun ada yang memang ada ADHD and dia memang constantly akan consult I. Macam dia message lah. Tapi even though dia willing to wait lah, walaupun dia selalu message, kadang-kadang kita akan reply during office hour ataupun lambat sikit kan. But then very good sebab I rasa bila dia selalu contact and beritahu update pasal dia, of course we feel like, oh okay, we are in the know of dia punya progress apa semua kan. So senang lagi lah nak buat treatment kalau macam tu. Okay, so next ni, this is very important question.
Khairiah, sorry I interrupt you, tapi I dah teringat apa benda yang I nak cakap tadi tu.
Okay, can.
Okay. Satu benda yang I perasan, kan macam Dr. Nizam kata kan, orang kata tu dia goyang-goyang kaki tu dia mungkin ADHD. Okay, bukanlah benda tu as a diagnosis, tapi for me, satu benda yang I perasan, kalau when I sit, I always need to bersila lah, and then change position. And maknanya nak katakan hyperactive kita tu sometimes it can just be benda yang macam you tak boleh duduk diam. Yang mula I taklah melompat-lompat. Tapi I ingat bila I meeting dengan staff dulu kan, I cakap boleh tak I nak duduk atas beanbag? Sebab from beanbag tu kejap I menyarap, sekejap I duduk, sekejap I terduduk, tukar-tukar position. So itu je lah sebenarnya yang I nak share tadi tu. Sorry sebab I teringat.
Bila dia adult, ADHD tu turns into restlessness.
Ah.
So So those movement yang kita basically we are seeking movement tu in order untuk bring down that restlessness lah.
Yes, I think so. Mungkin macam meeting kan, benda yang require a lot of thinking semua. So I tend to move a lot. Macam tu lah.
Nak cerita just interesting point
Okay.
dekat tempat kerja saya di Australia, masa saya kerja di Australia,
Ha.
staff tak semua staff buat kerja dekat meja. Kita ada komputer yang berdiri.
Yes.
So just to accommodate, because not everyone is the same, bukan semua orang jenis yang
Yeah.
duduk kena ikut kursi macam tu. So kalau staff tu dia nak buat kerja dia sambil berdiri, so there's a table yang tinggi without chair yang memang ada komputer, then they can do that. And so these are all sebenarnya tadi saya lupa nak cakap pasal treatment kan. One of the things yang juga included dalam non-pharmacological ni adalah environmental modification. Macam contoh study on beanbag, study on the floor, study atas bouncy ball. So semua ni dekat Australia ni benda yang biasa je. So you choose nak duduk atas kursi ke, nak duduk atas lantai ke, nak duduk atas beanbag ke, nak duduk atas bouncy ball. And you're not discriminated against just simply because you tak boleh duduk atas kursi. And so these are the things yang maybe kita kena think ahead kalau kita nak ada education yang more inclusive. You cannot just put them in program pendidikan khas simply sebab dia tak boleh nak duduk atas kursi. So that's not what inclusivity is all about.
Yeah.
Yeah, agreed, yes. So we have to like be more alert and sensitive on the needs of an individual kan, sebab semua orang berbeza-beza. Okay, the next question is about this is very important questions. Okay, yang kita nak I think many people want to know and we have to get the clarification. And usually people maybe want to know whether how common is for adult with ADHD to have co-occurring mental health condition like anxiety, depression kan. Sebab kadang-kadang macam tadi overlap, tapi adakah is it possible for ADHD to get other mental condition?
Okay. Alright, saya jawab bersekali dengan ada satu soalan yang singgah tadi. Dia tanya boleh tak depression anxiety leads to ADHD? Jawapan dia tak. That's not the way ADHD works. ADHD ni is a neurodevelopmental disorder. So it's not that because kita ada depression anxiety tak treated, kita jadi ADHD. Tak. Tapi orang yang ada ADHD boleh dapat co-occurring condition. In fact, studies have shown that 80% of those yang ada ADHD, dia akan ada another diagnosis. So maksudnya dia panggil comorbidity or co-occurring condition lah. So that co-occurring condition tu can be, contohnya for example, tadi kita sebut tentang substance. So ada yang struggle with substance, tapi ada juga yang struggles dengan psychological issues. So for example, those with ADHD are 3 times more likely to have depression. So depression ni can occur as the results of dia punya ADHD symptoms yang affect dia punya life, dan life issues tu affect dia punya mood. So contoh saya bagi typical tadi lah. So dia ada ADHD, as a result of ADHD, dia struggle dekat tempat kerja. So dia mungkin dibully, di isolated ataupun boss pressure dia tak boleh sustain job, menyebabkan emotional affected, dia dapat depression, for example. So that can happen. Or issues dengan pasangan and then dapat penceraian and then dapat masalah kemurungan disebabkan perceraian. So that can happen lah. So another yang common juga, especially the younger generation ni adalah comorbid with anxiety. So around 47% of adults with ADHD also meet criteria of anxiety disorder. Anxiety disorder ni contohnya dia dapat social anxiety, dia tak boleh nak present depan orang, dia tak boleh nak function dengan orang, anything to do with human to human interaction buat dia rasa tak boleh nak cope, ataupun dia mungkin ada panic symptoms. So these are certain issues yang boleh berlaku kepada orang yang ada ADHD. Sebab tu sometimes it's the other way around lah. So they came to clinics for depression anxiety and then we diagnose them with comorbid ADHD, or the other way around lah, dia ada ADHD and then later membesar dapat second problem as an adult, as an adolescent or adult, dia dapat depression anxiety, tak nak pergi sekolah misalnya. So that can happen as well. Tapi saya sebut ni as in general, do not diagnose yourself. Bukan semua orang yang ada ADHD akan develop this problem. Selalunya dia jadi in the context of sama ada symptoms tu tak manageable, dia punya life affected by it, ataupun tak ada support system lah. And so kalau ada support system, lepas tu dia start belajar untuk compensate for all those difficulties yang ada in life, dia may not end up dapat these disorders pun.
Okay, how about doktor, kalau if comorbid with other neurodevelopmental disorder macam ADHD with autism, so adakah keadaan sebegitu, and how actually what are the challenges macam bila you ada autism and also ADHD, sebab dia punya kriteria tu kan macam agak orang kata berlain, maksudnya bertentangan kan. ADHD and autism tu ada beberapa kriteria yang agak bertentangan. So what are the challenges that orang yang being diagnosed with
So
autism?
what's interesting about ADHD and other neurodevelopmental disorder macam autism, intellectual disability, specific learning disorders adalah mereka ni share common risk factors. And so risk factors dia is genetic, family history. Yang kedua, perinatal issues, perinatal medical problem, perinatal psychological problems, birth issues, and or anything yang affect brain sewaktu development. And so dia ada common risk factors. Cuma ada orang dia jadi autism, ada orang jadi ADHD, ada orang jadi ID tu depending on dia punya genetic predisposition dia yang mana banyak lah. So soalan dia tadi comorbidity. So again, another common things, around 50% of those yang ada autism akan ada juga hyperactivity. Those yang ada ADHD, 50% of them akan ada juga ASD-like problem. Those yang ada ADHD, around 50% juga, senang nak ingat numbers ni sebab dia lebih kurang sama. Akan ada learning difficulties. Sama ada intellectual issues ataupun specific learning problem lah. So memang dia challenging. Sebab apa? So for example, macam orang yang ada ADHD, one of the management dia adalah therapy. Dan therapy tu akan ajar life skills untuk compensate for the difficulties. So kalau dia ada autism, so mungkin dia a bit rigid nak tukar cara dia, ataupun dia ada learning difficulties nak belajar skills baru, dia akan jadi challenging. So semua-semua ni akan complicate things lah. So not to say that tak boleh dibantu, tapi as a therapist, they just have to know apa challenges lain yang ada so that dia boleh tailor dan modify. So contohnya macam orang yang ada autism, orang yang ada ADHD, one of dia punya management dia adalah kita ajar dia organizational skills. So ajar dia labeling, ajar dia guna journal, ajar dia guna reminders, guna alarms and whatnot. And so certain orang yang ada autism for example, mungkin dia tak boleh nak relate. So kena visualize kan benda ni, kena color coding kan dia, ataupun kena role play kan dia. So just kena modify cara lah. Itu je lah.
Okay, thank you, Doctor. Okay, the next is I want to ask to Dr. Atiyah. Okay, for those you has been diagnosed as adult. Okay, maybe you can share what are the signs, what were some signs that you miss as a child, the signs of ADHD. Yeah.
Yeah, okay. So I think Sarah ada mention tadi kan macam tak siap kerja rumah. Dia okay. Contohnya macam ni lah. Benda satu lagi bila ADHD ni kita nak recall yang the past pun tak kadang tak ingat sangat juga pun ya. Jadi rasa macam okay je. But we need to get history from others kan, for our friends ke, family ke. Tapi antara benda yang I think lah commonly for me, satu okay, last minute studying. Bila dekat sekolah tu I rasa mula-mula I tak faham sangat apa yang macam duduk dalam kelas pun. I just especially sorry to say but the system masa education system yang duduk dalam kelas cikgu bercakap je kau kesalin nota, benda tu actually for me was a change tau. Sebab before that my mum buat PhD kat London, so I pergi sekolah kat UK masa 9 to 12. And masa tu I remember like I can remember things that I learned and activities. So dia banyak hands on and dia banyak involving many ways of learning other than just duduk and baca buku and salin nota. So bila I balik Malaysia, I ingat duduk dalam kelas, cikgu cakap kat depan, semua orang salin nota. So I think for the first 2 years memang saya struggle. Saya struggle yang saya tak faham langsung apa benda saya belajar. Saya ikut je apa orang buat, saya ikut je. Pinjam lepas tu sebab takut cikgu marah, so saya pinjam buku nota kawan, saya salin balik. But I didn't understand. Tapi bila nak dekat-dekat PMR tu, I think ada the pressure, the deadline. I think also I pun dah getting used to the system tu. Study last minute, alhamdulillah memang boleh score. So I rasa kat situ kadang orang nampak macam orang yang maybe yang okay boleh pergi sekolah score ni, dia nampak macam dia tak ada problem. Tapi sebenarnya day to day punya learning tu, I really ada masalah. I tak tahu macam nak belajar. Even in medical school, I remember I told my friend lah, I don't know how to learn. I don't know how to study. I cakap, macam korang study ya, I tak tahu nak buat apa. Sebab I just macam baca buku je kan, boring kan. So tak ingat sangat. So I try buat nota. Tapi nak buat nota pun I tak tahu nak buat nota macam mana. So just tulis je lah. So dia macam executive function kita tu, I wasn't trained. I didn't have any skills. So I rasa macam betul now bila kita dah faham, especially like kata lah, mungkin kita rasa anak kita mungkin ada ADHD yang perlu didiagnose ke dah didiagnose, we need to help them in these things. You know, macam teach them the tools. Kalau nak tulis, macam bila you belajar how to do it, the various ways of writing notes, nak highlight ke, nak apa ke, because for me dia macam hit and run, you know, just buat je lah apa ni, lepas tu next one. Dia macam, dia panggil apa, reactive kan, dia more to reactive. So benda tu bila I fikir balik, I think that's very ADHD punya orang. Tapi dia sebab I could survive and boleh score exam ke apa, so dia tak nampak, dia macam masking sikit kan dengan apa yang kita punya struggle tu. And then one more thing I ingat, masa I form 4 sekolah for subjek bahasa Arab, for the whole of year 4 tu, rupanya semua orang ada buku nota. Bila cikgu tak bagi instruction, macam, okay ni kena ada satu buku, salin nota yang cikgu ni, I tak buat. Sebab I didn't know that you had to do that. Rupanya for orang lain, maybe it's common sense. But for me, I need to be told to do that. So bila the end of year, Ustaz pun cakap, okay semua orang kumpulkan buku-buku nota, Ustaz nak check. Pasal I was like, buku nota? Pasal I pun pusing ke kawan semua kan. Korang semua, apa ni? Atiyah yang kita salin masa ni. I was like, kenapa aku tak ada kan? Kenapa I tak ada benda tu? Lepas tu semua orang pun macam tak faham macam kenapa I tak ada benda tu. And I pula masa tu, for the first time I realised like, everyone had a notebook. So sepanjang yang setahun I duduk dalam kelas, I just dengar je. Sebenarnya tak dengar sangat pun bahasa Arab kan. So I just duduk je dalam kelas. And then bila Ustaz datang nak ambil, mana kamu punya? Saya tak ada. Oh, kamu tertinggal ke? Tak, memang saya tak ada buku nota. Ustaz pun terkejut, ni dah hujung tahun. Lepas tu Ustaz tu dia suruh I berdiri. And dia cakap dekat semua orang, okay kita semua orang aminkan doa. And dia baca doa yang Allahumma gfir laha warhamha wa'afiyah. Dia bacakan doa mayat tu dekat I, ya Allah. Lepas tu memang masa tu, I was in, tu kadang kesian lah tengok orang ADHD ni yang tak didiagnose, yang tidak diberi support, tidak diberi the
Sorry
treatment.
tergelak Tati.
It's
Not meant to
okay.
be unempathetic.
Masa tu kalau I cerita pasal, ya Allah memang kelakar gila sebab I really tak faham. Tak, maknanya bila I fikir balik, maknanya budak yang ADHD ni, kalau dia tidak diberi support, dia really clueless tau. Dia just go on je with life. And people accept them. Kalau orang accept them yang for their good character tu, happy tu, orang suka kawan tak apa. Kalau yang macam mungkin because they seem odd, apa tu kesian lah. So bila nak banyak I rasa lah what I miss at that time, my parents pun mungkin tak nampak sebab dia nampak result okay. Dia ni boleh pandai je, and then Tia ni budget belajar last minute boleh score. Tapi sebenarnya day to day punya struggle tu is real lah. Sampai kena doa mayat tak.
Okay.
Saya tambah sikit je example anak saya. Things that make me look back. Oh, I didn't realize that. Masa anak saya umur macam darjah 3, bila dia exam kan, dia exam markah dia 20, 30, and it was surprising to me lah sebab kita tahu anak kita ni tak adalah teruk tu. Dia pandai. Tapi kenapa dia dapat 20, 30? And then bila dia dapat kertas peksa, contohnya kalau kertas exam tu ada 5 muka, dia hanya jawab 2 muka sahaja. Dan 2 muka tu dia jawab dengan baik. Tapi dia ni kosong. Bila tanya, dia kata tak sempat. And then bila tanya cikgu, memang dia jawab 2 muka, lepas tu dia akan start berangan, dia akan start daydreaming, dia akan start wandering around, get distracted. There was one time, dia dekat soalan tu, dia jawab rukun solat, yang pertama ialah dibulatkan rukuk. And then kita cakap dia, abang, rukun solat pertama apa? Dia kata niat lah. Dia kata kenapa abang jawab kat sini rukuk? Dia kata abang pun tak sedar abang bulatkan rukuk. So that's dia punya inattention, dia tak kisah details. And then there was one time cikgu dia buat soal selidik dekat sekolah. Soal selidik tu dia tulis, saya rasa ibu bapa saya tidak menyayangi saya. Lepas tu dia bulat ya. Saya dah lah psychiatrist, buat buku psikologi sekecil apa semua. Tiba-tiba anak dia kata saya ni ibu bapa saya tidak menyayangi saya dah berdebar darah saya dah. And then saya tanya dia, abang, kenapa abang jawab macam ni? Dia kata, oh ada ya soalan ni. Apa pun tak tahu, dia main bulat aja. So those benda-benda kecil-kecil tu sometimes we don't realize bila kita put it
Yes.
all together. And so that's dia punya struggle lah, dia punya inattention lah.
Betul.
Reflecting back to apa yang Dr. Atiyah sebut tadi lah. So it's not that they don't know. Something missing between apa yang dia tahu kat sini dengan dia punya action. Yang
Yeah,
dia
lepas tu tak boleh nak explain. Macam bila orang tanya kenapa you buat macam tu, I don't know. I pun macam dia macam terzone out. Kenapa tak ada dia macam ada, I really don't know how to explain.
And orang yang ada ADHD ni selalu dia do something that is random kan, betul?
Yes.
Macam
that's the impulsivity. Maksudnya they don't do things without thorough macam timbangkan baik buruk and what not. So kalau dia day to day punya life ni macam makan apa, tiba-tiba random nak pergi kat mall ni, tiba-tiba tu tak ada masalah. Tapi sometimes they do random things yang besar. Tiba-tiba dia sign up for new insurance. Tiba-tiba dia sign up for new work. Tiba-tiba sign up, aku nak jadi volunteer dekat kucing punya kucing punya tempat jagaan lah. Benda aku buat ni. And so benda-benda macam tu yang sometimes dia akan create problems. So kalau pasangan tak faham, dia akan kata aku ni macam kahwin dengan budak umur 15 tahun dia kata. So sometimes they say like that lah. And then they akan struggle as a parents.
Yes.
Because dia punya inner child, inner child. Dia akan struggle as a parents in a lot of ways.
Yes.
That's a different topic.
Okay, so next questions, and I think very important also untuk just now I think Dr. Rozanizam has mentioned other than pharmacotherapy, other than maybe other formal treatment, kan? What are some practical strategies to improve focus and organization without relying solely on medication untuk those who having ADHD?
Alright. So saya jawab secara ringkas because some of it tu kita dah touch on here and there dalam this discussion. Basically, the essence of strategies ni adalah orang lain banyak benda dia boleh buat dalam ni. Maksudnya dia boleh organize things dalam kepala without having to plan it out di luar. Dia boleh set dalam kepala ni bila due date, apa yang penting, apa nak buat dulu, macam aku buat sekarang, aku tengah buat apa, lepas ni nak buat apa. So semua ni ada dalam ni. Because those yang tak ada ADHD, dia ada good organizational skills, dia ada good working memory yang memproses semua benda tu dalam kepala dia lah. So management of ADHD adalah tak boleh buat dalam ni, tak bermaksud kita tak boleh buat. Tak boleh buat dalam ni maksudnya kita kena buat dia di luar. So that's where organizational skills tu perlu di-execute externally. Contoh, kalau kita tak boleh distract kita punya environment ni kat dalam kepala kita, tak boleh nak filter, so kita kena filter our environment. So contohnya, bila kita tahu dah, kita ni easily distracted. So kita pula ada kerja, tengah buat master, tengah siapkan thesis, tengah writing. So janganlah buat kerja depan TV. Janganlah buat kerja tepi koridor sambil bawah tu ada highway, ada events, ada kenduri. It will not work because you know your brain, you know yourself, you know you'll get distracted. Dan saya punya passion bagi tahu, doktor dia kata saya duduk dalam kelas, daun-daun yang bergeseran satu sama lain tu pun saya rasa saya nak tengok. So that's how distracted they are. Ini kan pula pakcik tengah sapu sampah dekat luar, and then budak kelas 2 main game, semua tu akan buat dia jadi distracted. So you have to filter your environment. So sediakan environment yang kondusif. So janganlah belajar dengan 15 tab terbuka. Tahu kan, kita buka and then Telegram buka, WhatsApp buka, TikTok buka. So it will not work. So you have to filter your environment. So cari time yang memang clear from distraction. So ni benda yang you kena fikir. What it looks like for you. Okay. Yang kedua, orang yang ada ADHD ni, dia ada issues with sense of time. Sebab tu dia akan buat kerja last minute. Sebab tu dia tak ada sense of urgency. And sebab dia tak tahu what does 30 minutes looks like? What does 3 hours look like? What does things that due in 3 weeks looks like? Sebab pada dia, belum siap lagi, lambat lagi tu. So everything Sounds like that. And so you have to break it down. So set reminder, set timer, organizer, apa namanya, signposting, whatever it is yang help you to understand the sense of time. Contoh macam anak saya, there was time yang memang saya guna timer waktu dia nak buat kerja sekolah, guna jam pasir sebab kita nak visualizekan how much time you have left before you finish. Kalau tak tu, satu muka surat tu boleh ambil 3 jam. Lepas tu baru buat setengah, dia kata penat lah, dah lah, boleh tak nak buat benda lain. So memang kena bagi habis. Okay, so itu nombor apa tak ingat lah. So ingatlah benda-benda tu lah. So yang seterusnya adalah organizer. So it's very important. Organizer ni maksudnya you tak boleh macam situlah tempat belajar, situlah tempat you masak, situlah tempat you punya urusan rumah, itulah tempat you kerja. Everything has to have its place. And otherwise, things akan get messy. So even kalau kids yang ada ADHD, kalau parents kena buat bakul, kerja yang tak siap lagi, kerja yang tengah buat, kerja yang dah siap. So that they know how much they've done, how much they have not done. Kena visualize kan. Sebab they do not have this ability untuk visual dalam kepala dia, kerja aku banyak lagi ni, aku tak siap ni. Besok ada assignment lagi ni. So dia kena visualizekan benda tu. How many percentage you have done. Another thing is breaks. And so you tak boleh sustain kerja 3 jam straight, and memang you need break, even kita semualah, and so kena ada breaks, 20 minutes break, 20 minutes break. Another thing is exercise and sleep, and these are 2 things yang juga membantu for those yang ada ADHD. You need that movement, so translate that movement into some activities yang healthy lah, sebab orang yang ada ADHD pun ada increased risk untuk dapat cardiovascular risk and whatnot, so pun kena jaga juga, kena be mindful juga. And so kena ada active lifestyle, yang kena plan it out lah, jangan main futsal pukul 3 pagi pula, maksudnya kena plan it out, structure your day, so that ada component movement, ada component relaxation, ada component slow down, ada component sleeping, ada component eating, so that you boleh organize, especially kalau you look after other people lah, ada anak nanti semua, so benda ni pun kena disusun lah. Itulah antara benda-benda simple yang sounded macam easy, tapi terus yang ada ADHD akan susah untuk sustain. Dia mungkin akan start semangat buat, and so memang kena ada coach lah, memang kena ada orang yang support. So sometimes macam, to be honest myself, I struggle with a lot of this. Saya tak pernah buat tag saya sendiri, and sebab memang saya saya struggle dengan benda-benda yang detail-detail kecil-kecil tu. And so memang Allah bless saya dengan wife saya yang totally opposite of myself, very organized, very meticulous, sangat teliti, tak seteliti Abuya lah, tapi dia sangat teliti. And so dia compensate a lot of things. So dia tolong susun and whatnot. And then use technologies. So Google Calendars, reminders on phone, to-do list on app, so semua ni membantu. So make full use. Kalau dah jadi bos, ada PA lah, PA boleh buat. Kalau kita ni marhain macam saya ni, semua ni kita kena fikir cara untuk buat sendiri. Dr. Atiyah tak apalah, dia boleh hire personal assistant. Madam Khairiah dia ada banyak assistant dia dekat CCSC tu. So yang lain ni memang kena fikir. How do you go about having all this put in place? InsyaAllah.
Okay, so very nice tips. Okay, this is applicable not only for ADHD but also for normal people also kan. If we organize, we in terms of kita adakan section different, okay, kat mana kita buat activities tu, jangan buat kat tempat yang sama, semua makan kat situ, tidur kat situ, semua kat situ, so nanti benda tu akan jadi bertambah messy. And also visualize things that you need to do, filter the environment, very important. So all this maybe you can get from your coach, ataupun if you have a therapist, they will help you in terms of that also, monitor you. Okay, so next is this very important question juga, okay? Because Dr. Tia as a mother, kan? So the challenges that you experience as a mother, and how do you cope, a mother who have ADHD, and how you cope to juggle up between your life, you ada career, you ada you nak kena manage your anak and so on. So maybe you can
Sure. Memang it's very hard actually to be a mother at the same time to juggle your own personal struggle with ADHD. Sebab ADHD ni dia adalah struggle dengan benda yang basic life punya skills, benda yang basic yang wajib kena buat juga. Tapi untuk orang yang normal mungkin dia tak struggle dengan benda tu, but kita struggle. So that's why I think bila kita jadi ibu ni or ayah, dia lagi susah sebab dah lah nak jaga diri sendiri susah. Lepas tu nak kena jaga anak-anak pula yang kita sayang kan. So for me, the first struggle is that organisation tu. Okay, so because I'm very spontaneous. So dulu saya memang homeschool my children. So I noticed bila they are younger, it was easy because I'm very spontaneous. I'm a fun kind of mom. Kan, sebab dia kan spontaneous, budak-budak suka. Tapi bila anak dah semakin besar, then saya realise, oh my God, they need structure. I also need some structure. I tried to build the structure, but it's not easy to build the structure. So dulu pun saya macam, I was very, I'm still very influenced by Montessori punya education juga. Saya sangat suka because dia memang satu bagus untuk ada some kind of structure, tapi at the same time dia boleh allow you to be self-directed. So maknanya number one, bila as a mother ni, you need to find a way that can help you to organize kalau you ada ADHD. So macam guna tips-tips yang Dr. Nizam bagi tu is very very important lah. Maknanya dulu saya mungkin tak tulis benda yang saya nak buat sebab kita confident ingat you can remember everything, but you cannot. So Google Calendar, everything saya kena masukkan actually. Actually to be honest, Khairiah, bila this webinar I dah excited semua tu kan. Tapi actually I tak masuk ke dalam my Google Calendar sebab I currently ada tengah manage some things lah for my parents ni, so banyak sangat benda dalam kepala. Until you hantar I the forum questions. Which nasib baik you hantar I forum questions 2 days ago. Baru I teringat, oh my God, I actually scheduled something else on Wednesday today. So I adjust lah benda tu. So maknanya you should love your brain but don't trust it because you need the external help. So untuk ibu-ibu kita kena tu, and then I think kena blockkan masa. So saya dah dulu kalau tak saya pernah spontaneous dengan kawan saya pergi makan dekat IUI, and then terlalu dekat Maharaja Karaoke, tak pernah pergi, tapi spontan je nak nyanyi, jom kita pergi. You faham tak? Dia punya spontaneity tu tak masuk akal until saya terrealize. Lepas tu my friend cakap, you boleh ke sekarang? I'm like, boleh, tak ada apa-apa. Padahal waktu tu pukul 1 and I kena pick up my daughters at 2. You faham tak? Dia punya kadang-kadang randomness itu. So from there I realised, bila I dah learn my lesson lah, so I realised masa tu adalah I need to learn to block. Maknanya within this time to this time I tak boleh letak apa-apa. And then dia jangan macam kadang-kadang kita overshadow juga. Kadang ADHD dia ambitious. Dia kan tak boleh break kan. So dia akan letak banyak benda dia rasa dia boleh buat. Walaupun dia sebenarnya boleh buat. Kalau dia tengah hyperfocus dia boleh buat. Tapi kita kena take into consideration. Macam saya cakap kita punya penat, travelling time dan sebagainya. So which I think this other struggle is we over want to do things. Very ambitious, tapi you need to learn to just do 1 or 2 things that really matter. And then my other struggle yang besar sampai sekarang adalah memasak. Sebab memasak adalah task yang sangat susah pada saya. Itulah, so macam dah ada Thermomix pun, Thermomix pun susah. So, ya Allah tak tahu nak cakap. Tapi I rasa on the positive side, orang kata ADHD ni kan dia punya inner child, dia still very much like a child actually kan. Kita relating to my children tu is better. And then I also learn that I need to create certain boundaries sebab kalau tak I pun terjadi budak-budak sekali dengan my anak-anak, which is not good lah. Takkan kita pula nak jadi same level dengan the kids. So apa lagi sebenarnya ada tulis je yang important for mother tu lah, sticking to a routine is hard for me. Tapi bila anak-anak dah pergi sekolah, dia orang ada rutin yang hantar, dan senang I nak schedule my other work. So sebelum ni very spontaneous, very easy to follow the flow punya kind. As the child grows, they need more things. I evolve with them lah. And also bila anak bercakap, saya senang zone out kadang-kadang sebab kita kan senang fokus benda yang kita interested kan. So kadang-kadang bila anak-anak punya topik, saya tak perasan tapi kadang saya terzone out. Bila dia cakap tu saya distracted, my mind goes elsewhere. So saya tak boleh nak kadang sambut balik apa yang dia orang cakap. So benda ni saya take effort lah untuk learn apa yang interest dia orang, supaya saya bila dia bercakap tu saya boleh balas balik dengan benda, maknanya benda tu pun jadi interesting untuk saya. Sebab kalau tak benda tu saya susah. And then satu benda yang saya nampak wish maybe ibu-ibu tak perasan ni, kita cepat rasa overwhelmed lah sebab emotional part tadi. And maybe I terus share lah Khairiah strategies yang I guna lah for me to, macam tadi lah I know macam bila organize kena ada jadual apa, things that I help me lah, Google Calendar dan sebagainya. And then I need to schedule my own downtime. Sebab kadang-kadang bila I very overwhelmed, actually I really need to go into my dark room. Benda ni I tak perasan kenapa I suka buat benda ni. Then I realise, oh actually because maybe I terlalu overload dengan stimulus ke apa benda. I need to, contoh I penat kan, pergi sana sini banyak benda, I kena masuk bilik, I kena tutup semua curtain, buka aircon, I just kena baring je. And that helps to calm me down. Then I energetic balik untuk be with my kids and do my other tasks. Thank you.
Nice sharing, Dr. Atiyah. Okay, ada orang tanya tadi, saya terbaca kat komen ni, Dr. Atiyah ni tak ke anak kepada Prof. Muhaya? Soalannya. Ya, betul.
Itu ibu saya. Yang saya sendiri diagnose ibu saya juga.
Okay. Tak ada orang nak tanya mak saya. Mak saya ada kat kampung.
Masya Allah.
Siram bunga.
Masya Allah.
Kita dah macam dah out of time, tapi ada soalan yang penting ni nak kena tanya, because we also from counselling and career services center kan, so ada part career tu, so ada kadang-kadang we have client yang ada ADHD and so on, so we want to ask Dr. Rozanizam, how can someone with ADHD better manage the challenges of a demanding job or career? And in term of career lah, macam kadang-kadang diorang kan daripada job interest tu jumping out, macam tak diorang tak boleh stick on the same, and then kadang-kadang bertukar-tukar, and also manage nak be organised dalam masa in term of the job itself. So how, Doctor?
Okay. So kalau those yang study a lot of ADHD among adults ni, sometimes they also realize that tak semua career ni suitable untuk orang yang ada ADHD. And then sometimes orang ada ADHD, dia survive because of the career to support dia punya personal characters, traits, and macam mana dia behave. And so, having said that, maksudnya what I'm saying adalah sometimes issue dia adalah knowing yourself tu important. So that you know macam mana you nak spend your working environment. But otherwise, kalau working environment you tak suits dengan you punya character, and it's not just ADHD, we talk about personality traits and big 5 personality traits, for example. One of the things yang di highlight adalah match between personality dan juga career adalah antara indicator ataupun predictor for job satisfaction and well-being lah. So sebab tu penting satu untuk tahu kesesuaian career tersebut dengan kita. Itu satu. Yang kedua, another thing that you also need to know adalah benda-benda yang saya sebut tadi lah tentang organisation and whatnot tu, kita kena modify according to kita punya kerja. Because itu general principles. So every work is different. So bila kita dah kerja, contohnya kita tak ada luxury of choosing our work. Inilah kerja kita. Duit tak banyak, kalau berhenti kan nak cari kerja kat mana pula kan. Sekarang ni banyak yang menganggur and whatnot. So kalau itulah kerja kita, so try to fine-tune the needs dengan kita punya kemampuan. And so contohnya kalau kerja kita melibatkan organisation, then learn, equip yourself with organisation. Kalau pekerjaan tersebut memerlukan kita deal dengan orang, so as somebody yang ada ADHD, kita ada issue dengan emotional regulation, nak faham orang lain punya cara fikir and what not, then you need to learn. Because walaupun kita kata ADHD dia macam ni, tapi these are not fixed traits. So maksudnya ada benda yang kita boleh belajar. Contohnya kita tak boleh organize. Does not mean sampai ke sudah kita tak boleh organize. Ada certain organizational skills tu kita boleh belajar. And then brain kita ni, the beauty thing about the brain adalah walaupun problems of ADHD ni originated from the brain, at the same time, we also know that brain is a very plastic. Maksudnya dia very dynamics. Dia boleh dimodify. And so antara benda yang akan modify brain kita adalah through practice. And then we memang kena practice lah. And another thing yang mungkin saya juga boleh sentuh along this line adalah pentingnya kita communicate openly. Apa kita punya struggle, seek support, upskill yourself, cari resources yang boleh bantu kita untuk support kita. Dan hopefully kalau ada di kalangan yang audience yang mendengar ni, you are in the position of policy makers. Mungkin small policy that you can change dekat tempat kerja, you media manager ke, or even better you are top management ke. So think about macam mana kita nak adopt kita punya work environment tu supaya dia boleh suit orang yang ada ADHD ni. Because remember, walaupun kita daripada awal sampai sekarang kita bercakap tentang banyak challenges of those yang ada ADHD, at the same time you also need to know that those yang ada ADHD ni ada banyak kelebihan. Dan maksudnya dia ada dia punya strength juga. Yang mana strength ni kalau kita guna sebaiknya, dia sebenarnya akan benefit you as a company. Banyak orang yang arts, orang yang duduk dalam movie industry, orang yang duduk dalam inilah benda-benda yang creative industries ni, they are individual yang sebenarnya ada ADHD. Bukan nak kata semua orang ada ADHD, tapi orang yang ada ADHD duduk dalam arts industry, creative industry ni, they survive well. And sebab dia very creative, hyper focus on certain things yang dia buat, dia tak rigid in the way they are thinking, and then they was always on the go. Dia boleh buat kerja pukul 2 pagi, dia boleh pergi travel 3 days, 3 weeks somewhere just untuk settle satu benda yang orang yang biasa yang tak ada ADHD ni tak boleh buat. Yang 8 to 5 punya kepala ni tak boleh buat. And so kalau kita dismiss this group, mana we are dismissing around 5% of the population yang ada ADHD ni. And they might be the person yang sebenarnya valuable to your company, valuable to your organization. Just think about macam mana kita nak create this inclusive work environment, supportive work environment, so that everyone can benefit regardless of dia punya developmental status.
Okay.
Allah Allah.
Okay, so means that here, okay, even though
ada orang mak dia join lah.
ada orang mak dia join. Ada mak dia join.
Bukan mak saya, bukan mak Khairiah lah, tak tahu lah mak siapa. Thank you, Prof.
Yeah. Okay, thank you for joining. Okay, so means that untuk orang ADHD, not all career suitable for those people with ADHD, and the organization also need to know and how to actually give them, provide the inclusive opportunity and also place for those who maybe they can identify lah staff kan, the traits macam mana apa semua, so that they can support the staff and it can actually maximize the potential and the productivity of the staff itself. Okay, so this is the last question for Dr. Atiyah. Okay, and also later ada last question for Dr. Rozanizam as well. Okay, so in terms of being a person with ADHD, like macam apa yang you cerita experience masa kat sekolah, yang ustaz dibaca doa mayat apa semua tu kan, of course ada or understanding ataupun how people view you tu kan. So how do you handle? Ada orang yang mungkin kata, macam you cakap tadi, ada orang kata malas, which benda tu very sensitive kan, ataupun orang label you as someone yang memang agak negatif kan. So how do you handle and how do you want to actually tell people and educate people about this?
Yeah, okay, so I think firstly no matter what lah, the earlier the diagnosis is better kan, sebab apa-apa pun intervention yang early tu better. So maknanya for a person like me yang dah umur berapa masa tu, 34 lah kot, 35, dapat diagnosis tu. Dan sebenarnya kan diorang dah now dipanggil, I dengar kat Mel Robbins punya podcast on ADHD, because she has ADHD, dia dipanggil the lost generation. Maksudnya ada a group of women yang around this age yang dia diagnosed late, and sebab diorang tak dapat intervention and anything, so yelah, they struggle in when they are adults. So bila I perasan actually I'm not the only one who is struggling. So sometimes just knowing that, it soothes me. Maknanya kalau sebelum ni you live in your own head, you live in your own struggles, you ingatkan you are the problem. And of course, because Allah memang akan uji kita kat muka bumi ni kan. So Allah will uji us in a way that we have to trust Allah, that Allah only test us with the things that we can go through. InsyaAllah kita mampu sebenarnya untuk lalui ujian ni sebab tu Allah bagi kita. So, tugas kita ni adalah mencari bagaimana untuk saya hadapi ujian ni. So, personally for me, macam saya kata mula-mula kita rasa sedih kan bila dengan diagnosis, tapi pada masa yang sama lega sebab oh, I have something to blame it on. It's not just me. Tapi maknanya when you say blame pun, kita sebagai manusia yang dewasa, you have to take responsibility. So, understanding and knowing that, macam I cakap, I'm not alone. Rupanya ramai yang struggle macam saya di luar sana. Dan it helps to know that ramai juga orang-orang yang terkenal, orang yang berbakat, orang yang berilmu yang kita tahu, ya Allah, dia pun sebenarnya ada struggle. And actually I just discovered juga someone, orang in the mental health punya field, bukan orang Malaysia, orang yang saya rasa kalau sebut nama semua orang pun memang admire dia sangat. And dia sendiri mengaku yang he was also diagnosed with ADHD as a teenager. And despite the medication and all, tapi bila dia dah masuk Islam and dia dah find his journey, so dia kata bila dia dapat tahu what is his purpose, what is his interest, it is helping human beings, he's okay. Maknanya, insyaAllah if kita mungkin struggle disebabkan sistem yang kita kena fit into a certain system, maybe kita rasa struggle, macam mungkin saya dulu as a doctor, it's very hard for me to fit into that system, tapi of course kita akan ada struggle lah lepas tu, tapi bila saya dah mula craft my own journey to accept apa yang saya punya way of handling this, it helps me to go through the daily life. And saya kena acknowledge jugalah external factor which is the biggest impact is your family, suami dan juga ibu dan ayah dan anak-anak semula yang mana memahami. Dan kalau orang yang ada ujian benda ni, yang mungkin tak ada supportive husband, tak ada supportive parents, find a supportive group of friends. And ADHD punya orang ni, dia suka tau, bila dia jumpa another ADHD person, dia akan cepat terus buat WhatsApp group. Sebab cuba you all tengok lah you punya WhatsApp group, siapa yang create, mesti orang-orang ADHD. Sebab saya pun boleh tok balik, banyaknya aku create. Family semua saya yang created by Atiyah. Sebab dia sejenis excited and terus nak buat masa tu kan. So, you are not alone. It's of course, maknanya my friend cakap bila dapat tahu diagnosis, dia kata, Tia, I just want to say, it doesn't mean that bila you dapat diagnosis ni, terus you dah solve your problem, tak. You will still have ADHD, but in a way yang lagi okay, Alhamdulillah, lagi jelas, lagi you're not alone, and benda ni ada ups and downs. And apa tadi soalan dia? Yes, educate yourself, be contented with yourself, and know that macam Dr. Nizam sebut tu, ada strength kita. You have to find what are your strength, because kita ni semua memang sangat unik. Mesti ada kita punya keunikan tu yang diperlukan oleh orang lain yang kita boleh beri manfaat, insyaAllah. Macam saya pun, Khairiah, I can't believe that I'm here speaking about ADHD. I never planned this, but wow, now I'm here talking about ADHD. Dulu belajar in Psychiatrist posting about ADHD, and kita ada, orang ADHD, budak ADHD. Tapi sekarang, ya Allah, rupanya aku yang ada ADHD, and it's a pleasure for me to share my journey. Mula-mula mungkin kita rasa macam stigma ke, malu ke, tapi saya rasa no, I have to share with other people so that orang lain tahu yang macam doktor kata apa tadi at the beginning, it's not just about creating awareness about ADHD, but the truth about ADHD. And I hope my talk today, my session today has helped other people juga, insyaAllah. Thank you.
Okay, thank you, Tia. Okay, yeah, correct. First kali acceptance tu lah kan, walaupun difficult, but when you reach that, when you accept apa yang you hadapi, apa yang you lalui, apa diri you sendiri itu yang sebenarnya is the key, dan baru membuka jalan yang lain-lain lah untuk you lebih easy to handle and macam mana nak cope with the challenges. Okay, the last one, Dr. Rozanizam. The misconceptions about ADHD kan, ramai yang kata malas apa semua tu kan. How we differentiate yang memang betul-betul orang ni ada masalah dari segi disiplin dengan dia sebenarnya ada ADHD. Kan biasanya orang akan tanya macam tu, macam ke dia ni memang pemalas bukan sebab ADHD kan. So macam how we want to tell them that apa dia perbezaan tu.
Okay, right. So I guess this question is very important sebab a lot of parents yang struggle with this. A lot of children also membesar dengan mempercayai bahawa something's not right with me. Aku ni malas, aku ni tak pandai, aku ni tak belong here and what not. Without knowing sebenarnya apa yang they experience tu is ADHD. So when they come to us, they're already in the stage where sama ada school rejected them ataupun parents dah start feeling hopeless and helpless about them, and dia sendiri dah internalize people punya view about themselves sehingga mereka rasa dah there's nothing I can do about it. I'm not good. Saya ni tak macam orang lain. Saya tak macam anak orang tu. Saya tak macam kawan saya tu. So that can be very painful for a child untuk go through in life. Sebab tu saya selalu advise parents untuk take note of your children's development, um, engage dengan teachers, take note of teachers punya comment, don't be defensive, don't be denial. Kalau kita rasa ada concerns dengan anak kita. So our job is not nak differentiate ini ADHD ke ini malas. Itu kerja professionals. So let professional decide, let professional review dengan thorough assessment, dengan all the reports from schools, dengan observation, dengan feedbacks from parents, so that we know what we are dealing with. And then kita boleh manage anak kita tu accordingly. And ada banyak parents yang datang jumpa kita bila lepas kita dah diagnose anak dia, kita dah ajar macam mana nak modify the classroom environment, support dia ataupun some start on treatment and whatnot, then baru dia kata, oh, baru saya faham, rupanya selama ni cara saya salah. Oh, yang saya marah tu bukan dia malas, tapi sebenarnya dia struggle. Baru saya faham and this and that. And so kalau kita ada time to repair, tak apalah. And how about those yang membesar going through all of this tanpa ada closure, tanpa anybody towards the end cakap kat dia, sorry, I've been wrong all this while. So you're not wrong, you're not doing anything wrong. It's just us that tak nampak benda ni ataupun you do not get support that you get. And so penting. And at the same time, and saya pun nak remind again and again those yang ada dekat sini and siapa yang mungkin akan share this video to others, don't diagnose yourself as well, and then don't simply put benda-benda yang random things in our life ni dan kita kata oh ni sebab aku ADHD and whatnot. So get a proper assessment, then only baru kita boleh bercakap tentang ADHD ni. So kalau kita tak ada proper assessment, tak ada proper diagnosis, tak go through proper treatment, and then bila kita rasa kita ada ADHD, and then kita pula rasa kita boleh survive, kita akan undervalue orang lain punya struggle. And dia kata, aku macam tu juga, tapi senang je aku buat macam ni, settle. It's not as simple as that. And so you have to be cautious mana kita nak position ourselves. So yang betul-betul ada problem, just take a proper pathway untuk get yourself help. Yang tak ada tu, build your awareness tentang ADHD so that you can cope. 1 in 30 children akan ada ADHD. So basically in every classroom, there'll be one at least. Every neighborhood, there'll be one at least. So benda ni benda yang kita akan come across. Maybe kita punya staff, maybe kita punya student, maybe kita punya colleagues, maybe kita punya pasangan, and maybe anak kita one day. So just be mindful of this, be more accepting of this, and then continue to create this awareness, insyaAllah. Allahu A'lam.
Thank you to both our panelists, okay, Dr. Rozanizam and Dr. Atiyah, for sharing and giving all the very insightful content for today. And I believe that I think we can see the comment ramai yang kata sangat bermanfaat, sangat membantu, and then not many of us actually ada yang tahu pasal ADHD tapi tak tahu apa itu ADHD, the truth itself, kan? So I hope that this live or this program itself actually give awareness and the right info to the audience, inshallah. Okay, so I think we come to the end of the session. Thank you for accepting my invitation, okay, to be here again. And inshallah we will do more this kind of program later on, okay. Jangan serik untuk join kita lagi, okay, untuk memberi to educate our people with this not only ADHD lah, mungkin ada isu-isu yang lain juga yang berkaitan. And of course ADHD is very complex, and we need don't do your own, don't self-diagnose, okay. You have to see the professionals siapa yang you boleh jumpa, psychiatrist, child psychiatrist, clinical psychologist to get the diagnosis dekat mana-mana. Sebab this one I think ada yang tanya, so you can go to the hospital, even our public hospital also ada. We can if you go to klinik kesihatan pun sekarang diorang dah check in terms of developmental of the child, so you can just tell your concern and they will actually refer you to the psychiatrist or to the professionals to help you in terms of the diagnosis. Okay, so I think that's all. Thank you again. Okay, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Dr. Atiyah. Terima kasih.